A fracture is any break in a bone. Fractures can be classified as open or closed. As comminuted if broken in several places. As greenstick if the break is incomplete. Or as angulated if the broken bone is bent at an angle. With femur fractures, the large muscle groups of the thigh, quadriceps, and hamstrings often spasm, forcing the bone ends to override each other, causing pain and further soft tissue injury. Emergency care for all painful, swollen, or deformed extremities is splinting. An effective splint immobilizes adjacent joints and bone ends. Traction splints come in two varieties, bipolar and unipolar. A traction splint counteracts muscle spasms and greatly reduces pain. A bipolar splint cradles the leg between two metal rods. A unipolar splint has a single metal rod that is placed alongside the leg. Most patients do not begin to feel relief until the traction splint has been applied for several minutes and the muscle spasms subside. When applying a bipolar splint, firm traction should be applied to align the limb. Exert and maintain a firm pull to prevent bones from continuing to override. Applying manual or mechanical traction pulls against the muscle spasm, which causes the patient additional pain. In a bipolar or hair traction device, pull traction until the patient feels some relief and the spasms seem to subside. With a unipolar device, pull until the scale reads 10% of body weight or 15 pounds maximum. Follow manufacturer's recommendations and protocols with all splinting devices. Whenever the injury, effective splinting minimizes the movement, decreases the patient's pain, and helps prevent additional injury to soft tissues such as nerves and muscles. It can prevent a closed fracture from becoming an open fracture, and it can help to minimize blood loss.